Thanks, Allie. Well, fewer than 100 days until full implementation of Obamacare. And for many small businesses, that means a lot of changes are on the way. Barry Sloane is the CEO of Newtek, business services, and with what it means for small businesses and what they need to know. Nice to see you this morning, Barry.
Great to be here.
Ooh, I hope you can say it better than I just did. What in the world is an exchange? We've been talking about these exchanges. This is what small businesses are faced with. What is an exchange, and how do you purchase coverage?
Well, an exchange is an online marketplace, and there are private exchanges or there are public exchanges. Some of the public exchanges are set up by state government. Some of them are set up by the federal government. Matter of fact, where the Republican governors in many states like Florida and Texas have opted out of the ACA with respect to getting the Medicaid benefit, those people in those states, if they want to go to exchange, have to go to a federally set up exchange. So these exchanges are places for individuals and business owners to go purchase or acquire insurance for their employees or individuals.
So how should, if I'm a small business owner, go about getting insurance coverage for my employees and for myself, starting at just 100 days,
right.
2014?
Countdown's now,
yeah.
And we're a licensed insurance agent in all 50 states. We would strongly suggest that you use a broker because these exchanges are extremely difficult to navigate. As a matter of fact, they kick off on October 1 in many states, but we don't really think they're going to be 100% functional.
How are they difficult? What makes them difficult?
Extremely complicated. The purchase of insurance is not like buying an apple for $1 or $1.05. There's the cost of the premium, there's the type of coverage that you can get under the product, and then you have to look at the quality of the network. So you could have a network where there are doctors that are not in your location, maybe the network is overtaxed. So you can buy an insurance policy, you want to go to a doctor, and you find out that, gee, you call up Dr. A or B, and you can't get an appointment for 2 months, 3 months, or 4 months. So these exchanges are not simple things to navigate.
What about taxes? How will it affect the tax positions of small business owners? Obamacare.
Well, one of the issues of the Affordable Health Care Act is it's now taken a complicated purchase of health insurance and is combined with the tax return, because individuals and business owners can get tax subsidies which are supposed to offset the increase of premiums. This is how this was set up. So it is extremely complicated. Not all the rules are written from the IRS in terms of how you get these particular subsidies.
Can we look towards the Walgreens example as an opportunity for small business owners? Is that something that small business owners should consider, which is that they gotten subsidies or gave subsidies to their employees to allow their employees to go out and get their own health insurance coverage?
We seem to think that this Walgreens transaction, which was announced last week, is going to be a model, meaning that business owners, whether they're small and medium-sized independent business owners or large ones, are going to take advantage of punting this issue to their employees, giving them a cash subsidy amount and say, you now deal with it.
Yeah.
And it's more than just the purchase, because it's the administration of it. So individuals are really going to be taxed, not necessarily financially, but administratively in managing their own health insurance, even if they're employed by a company that's used to provide it.
Barry Sloane is the CEO of Newtek. We appreciate you joining us this morning. Thanks for breaking this down for us.
Thanks for having me.
I think you made it simple. I'm still complicated up here and rattling around. Thanks, Barry.